Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Good evening. This is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. They are offering free screenings for the next 2 weeks. At the end of the program, we'll give you numbers to schedule an appointment if you'd like to take advantage of that offer. We are live. In this half hour, we're going to be talking about back and neck injuries. So if you're having problems with your back and or neck, we urge you to stay with us for the next half hour. Maybe even call in a question. Our toll-free number is 1-888-634-7488, or you can call us locally at 856-767-8884. Answering your questions tonight, we have Dr. Kam Momi. Dr. Momi is a board-certified orthopedic surgeon, fellowship-trained in spine surgery. At Coastal Spine, Dr. Momi focuses 100% in the care of back and neck pain. Dr. Momi received his Bachelor of Science from Pennsylvania State University and earned his medical degree at Thomas Jefferson Medical College in Philadelphia. He completed an internship in surgery at Beth Israel Medical Center in New York City and a residency in orthopedics at New Jersey Medical School, and also has a spine fellowship at New England Baptist Hospital in Boston. Dr. Momi is a member of the American Academy of Orthopedic Surgeons and the North American Spine Society. Also with us tonight, we have Dave Anselmo. Dave Anselmo is a physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Cross Keys Physical Therapy Sports Medicine Center, located in Sicklerville, Woodbury, Washington Township, Vineland, Pennsville, and Swedesboro, and they are offering, once again, free screenings for the next 2 weeks, and at the end of the program, we'll give you numbers to take advantage of that offer. Right now, though, you can reach us toll-free at 1-888-634-7488 as we talk about back and neck injuries. Dave, let's start with the back. You've got the model there. Give us an anatomy of what's going on.
Let's start at the top, which is the cervical vertebrae. This is the light green here. There's 7 cervical vertebrae. Then we got the thoracic. These are the little darker below. There's 12 thoracic vertebrae. And we get down to the lumbar, which there's 5. Then you got the sacrum. As you can see, in between each one of these, there's a disc. And then behind here, you got the spinal nerves from the spinal cord. Let me get the little detail here. Here's a smaller level of it. And inside the disc here, which is really the key thing here, this is the disc. Inside this disc is a nucleus. It's a gelatinous-like material. And around this disc, there's an annulus fibrous ligament, which is very tough, like tire tough. However, like anything else, it has its weakness, which is posteriorly laterally. I explain to a lot of people, this is very much like a jelly donut. The jelly being the gelatinous-like material, if you push on the front of that jelly, or the donut, is going to push the nucleus or the jelly posteriorly. And unfortunately, if you look at this is where the spinal cord is right here in the back, and the nerve roots come out. That's exactly where the disc, with the annulus fibrous ligament, will give way, and the nucleus will come out and hit on that nerve root. And that will give you you'll see either a bulging disc or a herniated disc, and I think the doctor's going to talk about that later, the difference between the two.
Okay, before we get to that, Dr. Momi, what is the difference between an orthopedic surgeon and a board-certified orthopedic surgeon, fellowship-trained in spine surgery, and a neurosurgeon?
Well, neurosurgery and orthopedic surgery are 2 separate residencies that require separate training. There is a significant amount of overlap in that neurosurgeons do spine as well as brain surgery. Orthopedic surgeons do extremity and bone work as well as spine surgery. But the fellowship training is an additional year for either one of them, and it's essentially used to hone your skills as a spine surgeon and to develop them a little further. So to answer your question, the difference primarily is in how much spine surgery a given doctor does, and also the scope of training that they've had from their residency.
Okay, we're talking back pain, neck pain. What do you think, Dr. Momi, is the #1 cause of low back pain?
Well, as was pointed out here, the disc generally in the low back tends to be the #1 cause of low back pain. The other possible causes are the facet joints, which are these joints in the back of the spine. And finally, the most common problem that a lot of people complain about is sciatica, which is pinching of the nerves, which is from pinching on the tunnel of the nerves from the herniated disc.
Let's talk about sciatica before we talk about the disc. What is sciatica?
Well, sciatica is essentially a condition in which the result is pain down the leg. Now, this could be from a herniated disc, as we talked about before, or with age, particularly in people after the age of 50, the bones, especially in the lower back, can overgrow, and when they do so, they can start pinching on the nerves, and that can give you sciatica as well.
Okay, now you mentioned disc, and whenever you hear disc problems, you hear bulging disc, herniated disc, slip disc. Are these all the same thing, or is there a difference?
Well, it is very confusing. Radiologists may look at an MRI and say that that's a bulging disc or a slight herniation. A surgeon may look at it, and in fact, different surgeons may look at the same MRI and not be able to come to an agreement. The bottom line is there's a spectrum of herniated discs. You can have a slight bulge when the jelly portion of the inside of the disc tries to come out, on up to a frank herniation where a piece comes completely loose and is up against the nerve. But in between, it's very hard to call whether it's a herniated disc or a bulging disc. Just because there is a bulging or even a herniated disc does not necessarily mean somebody needs surgery for that problem.
Okay, let's go to the phone lines. Again, you can reach us toll-free at 1-888-634-7488. A local line, too, is available at 856-767-8884. Our first caller is from Gloucester Township. Mary, you're on Sports Doctor. Go right ahead with your question.
Hi, how are you?
Good, how are you doing?
Good. For a neck injury, I'm not sure if my husband's, if it's a herniated or degenerating discs. They tell him to be skeptical and not jump into surgery, but he gets a lot of migraine headaches that put him out of commission for like an entire day. Do you have any suggestions, either exercises or anything that can be done to maybe strengthen the area to alleviate the migraines?
Okay, or can migraines be caused by stuff that we're talking about here tonight?
Yes, they most certainly can, but migraines are a separate, specific entity that you have to make sure are not resulting from vascular problems in the brain. True migraines are headaches that before they come on, people tend to get discomfort with bright lights. They can have auras where they have lights or colors prior to the migraine. That's a distinctly different entity than just plain headaches. Although headaches from degeneration of the spine or bulging discs or herniated discs can be severe. The first thing to do is get an examination by a spine physician or your family physician and go from there. But there are exercises that can be done, and generally that is the mainstay of treatment if it is truly coming from the neck. And that's when we send patients to physical therapy primarily to try to alleviate that and strengthen the spine.
Dave, some thoughts?
Yeah, there's several exercises, but I think the most important thing, as the doctor nicely explained, is you really need to make sure you're addressing the right thing that's going on. Is it a migraine headache, or is it the fact that you have other things going on? I see a lot of patients that come into the office and they think they have migraine headaches. In reality, is they have a lot of stress and tightness in their cervical spine in the back, which we need to address, and which is easily addressed by us manually stretching you and showing you how you can do that at home as well. So you might be a great person who might want to come into one of our free screenings so we can take a look at you and obviously tell you what we think and show you some of these exercises right at our premises.
And Mary, at the end of the program, we're going to have numbers for the different Cross Keys physical therapy locations. All you have to do is call one of those that are near you, schedule an appointment, and you can take advantage of that free offer for your husband. Our toll-free number is 1-888-634-7488. Let's talk to Helen in Runnemede. She's our next caller. Helen, you're on Sports Doctor. Go right ahead with your question.
Yeah, hi. I had 2 surgeries in my lower back. One, it was done maybe about a year and a half ago, and the herniated disc, it hit the nerve. So they took part of the herniated disc out. 9 months later, it re-herniated and hit the nerve again where I got the pains going down my leg. So then they did the second surgery, which they fused L4, L5. Now, my question is I just had a knee surgery. Now, what kind of effect is that going to have on my back? And I still have another herniated above L4, L5.
Okay, a lot going on with Helen, I think. Will her knee surgery impact her spine?
Well, generally, if the spine is relatively pain-free, as what it sounds like happened in your case with the herniated disc and the fusion that you had done, that generally allows you to get the knee replacement and get knee surgery and recover from that fairly well. It usually does not impact the recovery for the knee. In fact, it can help it if your back is debilitating for you, because it can prevent you from participating in physical therapy for your knee. As far as the other herniated disc above the area where you had your previous fusion is concerned, that the treatment for that really would depend on what your symptoms are. The MRI appearance alone does not prompt any specific type of injection or surgery or even therapy for that matter. It's really your symptoms.
Okay, Helen, thank you for the phone call. We need to take a short break here on Sports Doctor, brought to you by Cross Keys Physical Therapy. I understand lines are loaded, so if you're having trouble getting through, please be patient. The toll-free number is 1-888-634-7488. You can even try that local line. And I heard that sometimes if the toll-free one is busy, the local line can get you through. It's 856-767-8884. We're talking back and neck injuries. You're watching Sports Doctor. More of our program right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute, the #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
Welcome back to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're talking back and neck injuries tonight. Don't forget, Cross Keys has that free screening offer, and you just need to call one of their centers to take advantage of that. We'll give you the phone numbers for that at the end of the program. You can reach us right now toll-free at 1-888-634-7488 or locally 856-767-8884 with your questions about neck injuries and back injuries. We have Dr. Momi with us from Coastal Spine and also Dave Anselmo, physical therapist from Cross Keys Physical Therapy. On the line with us right now is Bob from Woodbury Heights. Bob, thank you for holding. Go right ahead with your question on Sports Doctor.
Yeah, you're welcome. Due to an MRI, I have multi-level stenosis, and I wondered how long a recovery would be. I'm 82 years old.
82 years old, multi-level stenosis. What is the recovery time from that?
That's a very good question. The recovery time really depends. Well, first of all, is this a lumbar stenosis or a cervical stenosis problem?
I would say lumbar. I have disc bulges L2 and 3, L3 and 4, L4 and 5, and an L5S1 with multi-level stenosis. I did have a disc removed back in '91.
Well, for lumbar stenosis, the other question then becomes, do you have any scoliosis or any what we call spondylolisthesis, which means a slippage of one bone on the other? If you do have either of those conditions, then a fusion would be necessary at the same time as a decompression. A decompression basically means taking the pressure off those nerves. The exact procedure would then, of course, determine your overall recovery. Now, if you're talking about a straight laminectomy at multiple levels, that typically can be anywhere from a 2 to a 4-day hospital stay, depending on the individual. A lot of this depends on your pain tolerance. A lot of it depends on your functioning level beforehand. If you're 82 and you're a vigorous 82 and you've been walking and functioning well, then the recovery will obviously be much better.
Laminectomy, did you say?
Yes.
What is that?
A laminectomy is removal of the back part of the spine. That's the shingled portion here, along with this part, which is called the spinous process. The spinous process is the bump you feel when you run your finger up and down the back of your spine. A laminectomy consists of removing the spinous process as well as this area, which is called the lamina, on either side, leaving these joints intact. The advantage of doing that is that your mobility of your spine is not altered, and yet the pressure can be taken off the nerves, which are here in the center tunnel.
All right, Bob, thank you for watching. Thank you for the phone call. The number is 1-888-634-7488. Locally, it's 856-767-8884. We're talking back and neck injuries tonight on Sports Doctor. Dave, talk about aquatic therapy versus land therapy. Why do you prefer, or do you prefer aquatic therapy for patients with back problems?
Yeah, I do, and very similar to the lady that talking earlier about her knee thing, who's concerned about having a knee surgery. We really like to have somebody like that to put them in the water, because we like to take advantage of the buoyancy of the water, because most back problems occur from compression, and we know when we put our patients in the water, we're decreasing the compressive forces at waist level by 50%. When you go to water levels at shoulder level, we're decreasing it by 90%, so they're basically weightless in the water. And so we know also the water at Cross Keys, we're between 90 and 94, so it's warm. And it's very therapeutic. I mean, it's warm like that, you're increasing the oxygen, nutrients, and hormones called endorphins, which are normal pain relievers of the body. So there's a lot of benefits of putting them in the water very early. And the biggest thing we're finding is that we're able to get them to start on more functional levels a lot earlier in the water than we can on land. So I think the benefits have been pretty significant, that we're seeing a result of basically they're getting the people moving better, at least 8 to 12 days faster than we would if we just started land-based therapy.
Okay, and of course, aquatic therapy featured at Cross Keys Physical Therapy Sports Medicine Center. We're talking back and neck injuries tonight on Sports Doctor. Dr. Momi, what are some of the conservative treatment options for patients with common or routine back pain?
Well, most back problems are what we call axial low back pain, meaning the low back hurts. It's usually not sciatica, it's usually not anything more dangerous or more serious. So after an initial workup, including x-rays and an MRI to ensure that there's nothing dangerous, typically what we do is start people on anti-inflammatories, physical therapy, and if that fails, they can proceed to epidural injections. So the exact treatment really depends on the patient's pain, depends on their pathology, meaning what it is that's causing their pain, and then the patient's desires, of course.
Well, let me ask you this. What are some of the diagnostic tools that are used to help determine if a patient needs surgery?
Well, usually we use MRI, X-ray initially. If need be, we can proceed to injections, and that's what you see here. This is a basic schematic of a standard epidural injection. The injections can be tailored to the patient, to the exact levels in the spine. It can be up higher, down lower, depending on where the injectionist thinks the problem may be. After that, the other possibilities are myelograms, which if the MRI does not show the pathology clearly enough, or the x-rays do not, then a myelogram can be done. And a myelogram is essentially dye injected into the column, to the central column of the spinal canal, and here, for example, you can see a cutoff where the dye does not make it down below this area, and this is what we call stenosis, which the gentleman earlier was calling about.
Bob from Woodbury Heights.
Yeah.
Okay, thank you for that. We got one more slide to show you too. This would be?
This is a side view of an epidural or facet injection, in this case, in progress. Here is the needle, as you can see labeled, and here's the facet joint. This is one of the small joints in the back of the spine. This can be a source of pain as well, and facet injections can be a very valuable diagnostic tool in trying to figure out if this joint is the cause of the pain. That oftentimes can be missed as a source of pain if it's not looked for.
Okay, some of the diagnostic tools used to help determine if a patient needs back surgery. That's our topic tonight, neck and back injuries. You're watching Sports Doctor. We need to take a short break, but we'll come back with more of our program, more of your phone calls too. If you're having problems with your neck or your back, our toll-free number is 1-888-634-7488. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute, the #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
This is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Vineland, Pennsville, and Swedesboro, and they're offering free screenings for the next 2 weeks. At the end of the program, we'll hook you up with their numbers to take advantage of that free screening offer. Right now, you can reach us with your question about neck or back pain. Our toll-free number is 1-888-634-7488. Locally, it's 856-767-8884. We're pleased to have Dr. Momi with us, who is fellowship trained and a board-certified spine surgeon at Coastal Spine in Mount Laurel. Also next to him is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. And Dave, the low back pain problem is big in this country. Lots of people missing work because of it. What can someone do to minimize this?
Well, I think it's real important that you really you stabilize the lumbar spine. You try to take the stress off the vertebrae itself. We know the musculature in the front, which is abdominals, and muscles in the back, which are the back extensors. If you strengthen those muscles, you're going to lessen your chances of the stress going on the spinal cord. So really what we really talk about, you hear core musculature, you hear a lot about that now. That's basically what I'm talking about. You really need to work on the core to take the stress off the spinal column.
Someone called in and asked about an inversion table. Would that work to alleviate pain in the spine?
Well, yeah, there's people that have used that several times. I know people that have used very effective, and some people not effective for them. So it really depends on the person, but I see no harm in it. I've had people that have tried it and been very effective. It will actually decompress the spine as well. It's very much like I said, when you go into the water, it's just you're doing it in a different position.
Okay, Dr. Momi, talk about the different types of back surgeries.
Well, they really vary depending on the source of the pain. If the pain is coming from the disc itself, and the disc is the source of pain, then there are a couple of options that we have available nowadays. Traditionally, fusion, meaning removing the disc and getting the bone above and the bone below to heal together, was the mainstay of treatment. Nowadays, we have disc replacements, which, although they look like they are equivalent in treating the problem, similar to fusions, the jury's still out on the long-term outcome of those particular types of operations. The other type of operation in the low back that's done is a decompressive operation. As the gentleman called earlier about and asked about the lumbar stenosis problem, that's a decompressive procedure, basically going from the back, removing the bones enough to take the pressure off the nerves. Those are the two most common surgeries done for the spine, and those are the lumbar spine.
What is the most common site for spine surgery?
Most of it is lumbar spine as well, because it takes most of the load, does most of the work, and undergoes the most wear and tear in a lifetime. It tends to be the problem area. Neck problems are much less common because the weight of the head is not nearly as significant as the rest of the weight of the body on the low back.
Dave, what can physical therapy do to help someone who has back pain as a result of disc problems?
Well, there's several things. First, it starts with a thorough evaluation to find out what is really causing the problem, because sometimes we see patients that come in that say, or they think they have disc problems, and it might be just musculature. But thorough evaluation, but exercise is addressing that area is very important. We do some things. If it's a disc problem, if it's a bulging disc, there's things which we call McKinsey exercises, which we're trying to centralize the disc. And it's very hard to explain to them right here on TV, but someone that has that, there's exercises which we can do is to push the disc in the opposite direction, suck it in if you would, and get that pressure off the nerve root.
All right, let's go back to the phone calls. About 2 minutes. Nersha from Voorhees is our next caller. Nersha, go right ahead with your question on Sports Doctor.
Yes, please, doctor. I have a question. Whenever I move my neck, and left or right, I get a click kind of sound. I don't know why it happens. And this, I think so, nobody can hear, but I hear very clearly.
Are you having any pain as a result?
No, I don't have any pain, doctor,
Okay, talk about that. Is the sound a problem? Could lead to something?
Well, the main thing you want to make sure of in this type of situation is that you don't have instability of the neck, meaning that with time and with wear and tear, the ligaments that hold the bones together can loosen up. With arthritis, they can start to move excessively. When they do that, especially in the neck, you can get what's called stenosis in the neck, and that can start putting pressure on the spinal cord and start giving you problems walking with fine movement in the hands. If that were to happen, that's a significant problem and a dangerous problem that you should get looked into.
Okay, let me interrupt you for a second there because we're out of time. I want to give everyone the numbers for the Cross Keys Physical Therapy Center nearest you. If you're interested in taking advantage of the free evaluation offer, just schedule an appointment. In Sicklerville, you may do so by calling 856-728-1900. Woodbury, it's 856-853-0988. Washington Township, 856-374-3707. Pennsville, 856-678-8000. Vineland, 856-794-8300. And Logan Township, Swedesboro, 856-467-9911. I want to thank our guest this evening, Dr. Kam Momi, fellowship-trained, board-certified spine surgeon. He is with Coastal Spine in Mount Laurel. If you'd like to get a hold of him, their number there is 856-222-4444. That's 222-4444. Real easy number to remember. Dr. Momi, thank you so much for joining us. Also, Dave Anselmo, back from Disney. Great to have you back on the program here on Sports Doctor. We'll be back a week from tonight with another edition of Sports Doctor. Until then, for Cross Keys Physical Therapy Sports Medicine Center, I'm Joe Chipana. Stay well.